And as happens every Tuesday, we are now joined by In Focus health correspondent Linord Moudou. There's been a possible breakthrough in preventing the spread of HIV, is that right?
That's right, Vincent. A team of American scientists has discovered a molecule that could block transmission of HIV, the virus that causes AIDS. They say that the molecule called surfin prevents infection by binding itself to both the AIDS virus and to the blood cells targeted by HIV. Researchers say the preventive agent might someday be used in a topical cream to help prevent infection with the deadly virus. And Guinean health officials plan to vaccinate more than 250,000 people in the northeast region against yellow fever. The initiative occurred after a possible outbreak of the disease emerged in the region. There is no cure for yellow fever. Vaccination is the single most important measure against the disease. And the westernization of Africa has brought advances in medicine and healthcare, but the Western lifestyles may have also increased the incidence of one of its deadliest diseases, cancer. Khalil Gay has more.
33-year-old Samantha is a breast cancer survivor from South Africa. She was diagnosed with the disease when she was just 29 years old.
And I walked into the doctor's room and his face just told the story. His face was completely, I'll never forget the look on his face. And he said to me, I don't know how to tell you this, Samantha, but you've got a very, very aggressive breast cancer. And we have to operate immediately.
Samantha is one of over 700 participants in a recent global forum to raise awareness for cancer. The meeting of the African Organization for Research and Training in Cancer, or AORTIC, took place in the Tanzanian capital of Dar es Salaam. The event, sponsored by the American Cancer Society, draws government and health officials from all corners of the world. Experts say most cancer patients in Africa are diagnosed in late stages of the disease. In 2002, cancer claimed the lives of over 400,000 people across the continent, and this figure is expected to double by 2020. Professor Serine Gay of Senegal, the newly elected president of AORTIC, is determined to make his mandate count when it comes to resolving issues linked to the cancer burden in Africa.
First issue is to develop cancer training and education, because in many African regions, especially in sub-Saharan Africa, we're lacking of human resources. The second area we're going to work is to advise government NGOs to fund cancer facilities and equipment in every single African sub-region, and then to address the need for research.
But there's a lot to be done. Africa may not have adequate resources to address cancer and other chronic diseases, and experts say increased tobacco use will lead to higher rates of cancer in Africa.
Today in Africa, between 3,000 and 5,000 people are going to have their first cell beginning to split and become a cancer because they use tobacco. We can prevent that from happening.
African nations are facing the highest increase in the rate of tobacco use among all developing countries. And the global tobacco industry is targeting new African markets. Just days before the Dar es Salaam conference, a new tobacco plant opened in Senegal. The Prime Minister inaugurated it, saying the plant would create new jobs. But anti-tobacco activists in Senegal were outraged by the move. For her part, breast cancer survivor Samantha is crossing the continent on a mission to raise cancer awareness. If cancer is a harsh new reality in Africa, health experts say nations there will have to develop national cancer programs offering wider access to standardized treatments such as surgery, chemotherapy, and radiation. Khalil Gay, VOA News, Dar es Salaam.
Joining us now with more on cancer in Africa is Dr. Melanie Usher-Maleombho. She's a research pathologist and project director on cervical cancer screening in Côte d'Ivoire. Dr. Maleombho, welcome to the program.
Yes, thank you. Thank you for having me.
Tell us about the most common type of cancer in Africa among women and men.
Well, among the women, the most frequent cancer is the cervical cancer. And among the men, the most cancer is the prostate cancer.
Now we hear so much about breast cancer, but I guess it's a bit surprising to some people to hear that cervical cancer is the most common among women. Why is this happening?
Yes, because most of the case, the women with cervical cancer, they don't go to the hospital, so they are not registered. So that's why they are underestimated. So, but some workers, for example, some work done in Côte d'Ivoire has shown in Ivory Coast has shown in 2000 study from 2004, 5, and 6 that 1,500 new cases of cervical cancer per year. And most of the time, they are underestimated because what I told you, the patient does not go to the hospital very early.
And how can cervical cancer be prevented?
Well, the first thing is a lot of education. Try to explain the risk of cervical cancer, and have the woman to come to the hospital because they understand what they have. And usually they do. If you explain very precisely how a woman can catch cancer, what are the risks for her to have a cancer, and how she must prevent it by going very only to by having a screening test. Okay. At least one a year, it's enough.
Okay, Dr. Maleombho, thank you so much for joining us today. And Vincent, that was Dr. Maleombho. Back to you.
Well, that is very insightful. We want to thank you very much, Linord. Sure. Thanks a lot for joining us. And be sure, viewer, to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on In Focus.